My name is Divya Shah. I am an assistant professor in the Division of General Internal Medicine at Mount Sinai. I spend most of my time seeing primary care patients at Mount Sinai, and then I also teach the residents who are in training. Today we're going to discuss a really important and timely topic, which is, do antibiotics treat our respiratory illness? We're going to cover the following learning objectives. So what are the differences between viruses and bacteria? When you get a cold, should you take an antibiotic to help you get better? And what is the best and easiest thing that we can do to avoid getting ourselves sick? Reviewing the differences between viruses and bacteria, reviewing the indications or the reasons why you might or might not need antibiotics, and thinking about the best and easiest ways to protect us from respiratory illness this season. We'll start with the differences between bacteria and viruses. I really love this graphic here because it illustrates quite a few points. On the left, we have all of our different types of bacteria. What you notice is that they are these little organisms. They can actually live on their own. They are living organisms that do not require living inside of a host or a different type of cell the way that viruses do. And those are the viruses you see on the right. In real life, the bacteria on the left are also much larger than the viruses you see on the right. And finally, the types of illnesses that bacteria and viruses cause are very different. So bacteria, we'll go over some of the bacterial illnesses that common organisms can cause. But some of the viruses that we see on the right, these are viruses you may or may not be familiar with. So on the right here, looking at the middle bottom, you see influenza, which is the common flu. That is a virus. Adenovirus to the left of that is something that can cause a common cold. It can cause pink eye. It can cause like a GI distress or diarrhea. Very common virus. Ebola, I'm sure you've heard of. HIV, it's in the name, so that's human immunodeficiency virus. That's another example of a virus. And then hepatitis, both B, C, and other types of hepatitis, those are all viruses. Now, the difference is, again, that these viruses, they need to invade and live in another cell. That's called a host cell. So these viruses, they can't exist on their own. They're kind of like leeches. They'll get in there and they live off of the host cell. And then what you see on the bottom right, bacteriophage, that's really interesting. That's a virus that lives inside of a bacteria. But the big takeaways here are there are two totally different groups of pathogens or disease-causing organisms. Bacteria are much bigger. They live on their own and they cause certain forms of diseases that we'll cover. Viruses are smaller. They live in host cells and they cause certain diseases that we've covered here. Now, how can we protect ourselves? So there are a few big ways to protect ourselves from pathogens, which again are disease-causing agents. There are antibiotics, which are drugs that kill bacteria, antivirals, which are drugs that treat viruses, antifungals, that are drugs to treat fungus, and vaccination. So vaccination uses your body's own immune system to basically preventatively or preemptively guard against attack. Starting with antibiotics. So antibiotics can only be used to treat bacterial infections. This is a very important point of this talk. How do antibiotics work? So they actually target specific structures, usually on the outside of bacteria, to target and kill them. Viruses don't have those same structures, so the antibiotics are simply not effective against viruses. Antibiotics used to be made actually from a fungus back in the day when we first made penicillin, but now most are made artificially. And unfortunately, antibiotic resistance is becoming a major problem. What is antibiotic resistance and how does it occur? In a nutshell, it's when an antibiotic does not kill the target bacteria anymore. Now, how does this happen? More or less, antibiotic resistance is a condition where bacteria keep growing even when an antibiotic is around. The most common way this happens is unnecessary use of antibiotics. So using them too much, too frequently, or in the incorrect scenarios can lead to what we see at the top here. You see that you have a sort of normal angry looking bacteria. Then you add that to the indiscriminate use or unnecessary use of antibiotics, and you end up getting this very angry looking sort of super bacteria. This is not something we want for ourselves as individuals, for our families and children and communities, and also on a global perspective when we think about global health and population health. So that was antibiotics. Moving to our second category, which is antivirals. Antivirals can only be used to treat certain certain viral infections. Now, the big difference between antivirals and antibiotics is that antivirals don't really kill or disarm the virus permanently the way that antibiotics do for bacteria. They really only shorten symptoms by usually 1 to 2 days. Antivirals are also usually only prescribed to patients with very severe symptoms from their virus or those people with a greater chance of developing complications, for example, because of their age or because they have high-risk medical conditions. And just like antibiotics, there is also a risk of antiviral resistance. The most common antiviral that you may have heard of is Paxlovid. It's an antiviral for COVID or coronavirus. Note the third bullet point here. Paxlovid is really just for folks that are at risk for progressing to severe illness, people that are at risk for getting hospitalized, people that are elderly, or have underlying diseases like diabetes, lung disease, heart disease, etc. And then finally, vaccination. This is probably the number one way to protect yourself. Vaccination, again, tricks your immune system into making antibodies that destroy foreign particles or foreign bodies, including both bacteria and viruses. And basically, your body's going to remember how to make these antibodies when the real thing invades. We do have vaccines for both bacteria and viruses. For example, the flu shot, the COVID shot, those are all for viruses such as the influenza virus and the coronavirus. But if you've ever heard of the pneumonia shot is actually a vaccine against Streptococcus pneumoniae, which is a bacteria that causes pneumonia or infection of the lungs. So even though we've spent a bit of time thinking about how different viruses and bacteria are and how different antibiotics and antivirals are, vaccination really is a commonality that we can use to fight both and to prevent both. Now, how are vaccinations made? Vaccinations are usually made from a weakened version of the virus or an inactivated version of the virus, or sometimes they just take a piece of the virus and bacteria to make the vaccine. One thing I want to address is the idea or sort of myth that vaccines can make you sick. So, of course, they can give you some side effects. Those are expected side effects that happen when our bodies are forming these antibodies so that they can be protected. But vaccines cannot give you the illness or the disease which they are made to protect you against. So the idea that the flu vaccine gave you the flu is actually not really possible because it is a killed or inactivated or partial virus that they're using. Are antibiotics effective? What about antibiotics for the new coronavirus? So given that coronavirus is a virus, antibiotics do not work against coronavirus. Even the new coronavirus, if you get sick with COVID, you have a positive COVID test, even if you're feeling pretty sick, at the end of the day, it is a virus and antibiotics should not be used as a means of prevention or treatment. Of course, if you are hospitalized or you have very severe symptoms, so very high fever for several days, chest pain, shortness of breath, those are reasons to seek medical care and possibly emergency medical care. And in those cases, if they think you have pneumonia or bacterial pneumonia on top of your coronavirus, you might get some antibiotics. For the vast majority of uncomplicated COVID, though, you don't need antibiotics. So when do I need antibiotics? The idea is sometimes you do, sometimes you don't. And when in doubt, always ask for help from a medical professional. Your doctor, your pharmacist can very clearly guide you on these topics. So on the left, we have some times where you may need antibiotics. One is called whooping cough. This is actually very rare. It's also known as pertussis. It's actually more common in children. The next is strep throat. So strep throat can be tested for and should be tested for. And a clinician or a doctor can make the diagnosis clinically by doing a throat swab, which if it comes back positive for strep, they can certainly give you some antibiotics. Finally, a urinary tract infection or UTI is usually treated with antibiotics. Symptoms of that include burning when you urinate, urinating more frequently or more urgently, fever, chills, or back pain. Those are some signs of urinary tract infection. But again, you really don't need antibiotics if you have these things on the right, such as a common cold, a runny or stuffy nose, bronchitis, or a chest cold in otherwise healthy children and adults does not need antibiotics. Even if the mucus is yellow, green, brown, it doesn't matter what the mucus color is. It's really about what organism is causing my illness and will this treatment actually work for that organism. The flu, of course, is a virus, don't need antibiotics. Sore throats other than strep throat, and if you have some liquid or fluid in your ear, Many of those are caused by viruses. And again, a medical professional can take a look in there, let you know if you do need antibiotics or not. So, what can I do if I have a virus, if I'm sick with the common cold? Actually, it turns out there's a lot you can do. There are a number of over the counter remedies. There are decongestants, things like Mucinex DM. There are over the counter cough medicines like Robitussin, or the active ingredients are dextromethorphan and guaifenesin, which basically suppress the cough and help you cough up that mucus. Antihistamines can be used either as a nasal spray, eye drops, or through a pill. Heating up some hot water with salt and gargling that to soothe your throat. NSAIDs are a class of anti-inflammatory medications and fever reducers. Some common examples are ibuprofen, which is Advil, or Aleve, which is naproxen. You can also use Tylenol. Tylenol is a great option with few side effects that can help reduce your fever and body aches. Drinking lots of fluid, at least 6 to 8 glasses of water a day, and hot soups, broths, and tea. Rubbing a vapor rub on your chest or below your nose. Getting lots of rest. You can always reach out to your doctors for a doctor's note to make that happen so you can take a day off of work. And then other things I'll briefly mention: zinc lozenges, echinacea, which is found in plants as an anti-inflammatory, and running a warm bath. So these are really the kinds of things that can help you with symptoms of a common cold, which is usually caused again by a virus, for which antibiotics are really not going to work. Do I really need antibiotics? So I want you guys as a community to take charge and feel comfortable knowing when to say yes to antibiotics and knowing when to say no to antibiotics, because you really can play a role in preventing antibiotic resistance. So say yes to antibiotics when you need it for certain infections caused by bacteria, and say no to antibiotics for viruses like the cold, the flu, runny noses, even if the mucus is thick or yellow or green. And remember, antibiotics are not going to help even for some common, like other bacterial infections like bronchitis, sinus infections, ear infections. A lot of them can go away on their own with time. Antibiotics really are needed only for certain infections caused by bacteria, and that is the major takeaway. If you're not sure, seek help from your doctor, your pharmacist, or another trained professional in the community that can help you. And remember, because of everything we talked about, it's important not to get antibiotics from friends or family without a prescription from your doctor. So people at risk for long COVID are those who did not have any COVID vaccines, those who had really severe COVID, maybe you were hospitalized, etc., and those with prior or underlying health conditions. Some of the common symptoms are listed on the right. So coughing, chest pain, shortness of breath, loss of smell or change in taste that does not come back, body aches, headaches, insomnia or trouble sleeping, brain fog, fatigue, and mood changes. Really, a lot of people have this long COVID after a prior COVID infection and don't even know it. If this sounds like you, and we encourage you guys to use the QR code on the bottom right, or you can visit www.smartuniversity.org. Remember, there's no test for long COVID, so try to seek out these resources, which include long COVID clinics, programs, and community support if you think that you might be suffering from long COVID. And finally, stay up to date on those vaccines. As I've mentioned, it's really the best and number one way that you can prevent yourself from getting sick with both viruses and bacteria. As a reminder, we have a new 2024 COVID booster that's available for everyone over the age of 6 months. If you're unvaccinated, you need 2 doses of Moderna and 3 doses of Pfizer. We do have a new flu shot as well, or the 2024 flu shot. The earlier the better in terms of flu season and getting the flu shot. RSV is for folks over the age of 60, and as of right now, it's a one-shot deal. We're not repeating that vaccination. Once you get it, you're good for a bit. And the pneumonia shot, which is indicated for people who are over 65. If you're over 65, ask your doctor about the pneumonia shot or your pharmacist. If you're under 65 and you have certain conditions, which you can see on the right, you're pregnant, HIV, cancer, diabetes, heart disease, also smoking, cigarettes, asthma, those are reasons to ask about the pneumonia vaccine.
Somebody was mentioning earlier on that they feel like doctors used to prescribe antibiotics a lot more than they do now. Some of it seems like it's because of this awareness about the resistance that can develop.
Absolutely. I think there's been more awareness on the community side and on the provider side. I think
Hmm.
we've noticed over time that there are more and more multi-drug resistant organisms, which basically means we're breeding bacteria that are not responding to the treatments that we have. It's a really scary thing, and we have to all do our part basically to try to prevent that from getting worse.
You had said the importance of not like sharing antibiotics with other people. Can you reiterate what some of the reasons are why that's problematic?
We'll start from sort of the beginning, which is before you take the med. The idea, again, is do you really need the med? Is the medication,
Hmm.
the antibiotic, going to treat your problem? So, for example, you may think you have a bacterial illness or a pneumonia when you really have the flu. Taking those antibiotics isn't going to help, and it can just lead to resistance. Once you
Hmm.
start taking the med, the antibiotics can have side effects. So, antibiotics can kill some of the good bacteria in our gut. They can lead to stomach discomfort, diarrhea. Those are some of the side effects of excess antibiotic use. And those are side effects that you didn't really need to have, especially if you didn't
Hmm.
need to have that drug. And finally, the dosing for each person can be different, and the
Sure.
considerations for every person is different. So you may have kidney disease or liver disease. Had your doctor known that you needed antibiotics and they agreed, they may prescribe you them, but at a lower dose because the drug is metabolized by your kidneys. So those are all things to consider when you're sharing antibiotics with other people. Are I may not really need this, I may have
Hmm.
bad effects from this, and it may not be the right dose or type of antibiotic for my body.
Is there a relationship between antibiotics or old antibiotics and something called C. diff?
So C. diff stands for C. difficile, which is an organism, it's a bacteria that can cause really severe diarrheal illness. So I'm talking about high fevers, 103, 104, severe watery and sometimes bloody diarrhea. It usually lands people in the hospital, although sometimes it can be treated outpatient. Now, what causes C. diff? So C. diff is very related to use of antibiotics. And there can be certain antibiotics, and your provider would know this, that if you've used in the preceding, meaning the 3 or 4 weeks before you get C. diff, that it may trigger in their mind, maybe they got the C. diff infection from using antibiotics. So this is another very real concern about antibiotic overuse and the risks of using antibiotics when you didn't really need them. Of course, if you do really need them, I don't mean to scare people about
Mhm.
using antibiotics when you really need them. The risk of C. diff overall is pretty low. Like I said, certain antibiotics carry a higher risk than others, and that's why some providers will choose the ones with a lower risk of C. diff. But again, if your doctor recommends it, it's a good idea to go ahead and take it. If they're saying you don't need it, you probably really don't need it, and they're worried about giving you side effects or long-term effects. Bronchitis can be viral or bacterial, so it's a little
Mhm.
tricky. Most cases of bronchitis are actually viral.
Okay.
Again, they're usually unlikely to respond to antibiotics. It can be very pesky. It sort of like sits in your chest and you feel like you're
Mhm.
wheezing and coughing, and you cough and you cough and you cough for 3 or 4 weeks after the acute illness with the runny nose and the headache and the fever. But it does go away. And if you feel like you're having symptoms, talk to your doctor, talk to your pharmacist. There are inhalers, there are other sort of medications and over the counter things you can take to loosen up some of that mucus and calm down some of that wheezing to help you feel better.
And bottom line on a lot of this too is like talk to your doctor in cases of having any sort of respiratory illness. And I think another thing is just to sort of challenge that underlying assumption that antibiotics are like the thing that cures everything.
The way I see it is they work really well for certain things. So let's keep it that way,
Hmm.
right?
Sure.
Let's keep it so that they keep working against the things they were made to protect us from. And let's not overuse them so that we then lose that power that they do currently have.